this is Census Selden, and thank you for joining me today for another exciting episode of Parentology.
Let's take a look at the topics covered last week.
Between the age of 20 to 30, at this age, a woman is fully developed and ready for the pregnancy.
If you're trying to get pregnant in your 20s, time is on your side, and biology is too.
While most teen pregnancies are unplanned, even a planned pregnancy has risks and potential complications. Today we will take a look at all the other common symptoms of pregnancy. You might not experience any of the pregnancy symptoms until around the time you noticed you've missed your monthly cycle. Perhaps the most obvious early symptom of pregnancy is when you have missed your period. This possible sign of pregnancy is often what causes women to search for more details about the other pregnancy symptoms. Some women might only experience a much lighter period compared to their usual. Your breasts may provide one of the first symptoms of pregnancy. As early as 2 weeks after conception, hormonal changes may make your breast tender, tingly, or sore, or your breasts may feel fuller and heavier. Fatigue and tiredness also ranks high among early symptoms of pregnancy. During early pregnancy, levels of hormone progesterone soar. In high enough doses, progesterone can put you to sleep. At the same time, lower blood sugar levels, lower blood pressure, and increased blood production may team up to sap your energy during your pregnancy. This was probably why I was so tired during my first trimester. I remember having superpower naps just about anywhere. I miss those days. When you're pregnant, you might find yourself turning up your nose at certain foods, such as coffee or fried foods. Food cravings are common too. Like most other symptoms of pregnancy, these food preferences can be chalked up to hormonal changes, especially in the first trimester, when hormonal changes are the most dramatic. You may also find that certain foods you used to enjoy are suddenly and completely repulsive to you. I could not stand the smell of cooked food and resorted to eating a lot of fruits and salads during the first few months. Although I did not have any cravings as such, I enjoyed eating 3 to 4 bowls of ice cream a day. Does that count as cravings? In early pregnancy, increased blood circulation caused by hormonal changes may trigger frequent, mild headaches. Constipation is another common early symptom of pregnancy. An increase in progesterone causes food to pass more slowly through the intestines, which can lead to constipation. The flood of hormones in your body in early pregnancy can make you unusually emotional and weepy. Mood swings are also common, especially in the first trimester. As your blood vessels dilate and your blood pressure drops, you may feel lightheaded or dizzy. Early in pregnancy, faintness also may be triggered by low blood sugar. Shortly after you become pregnant, hormonal changes prompt a chain of events that raise the rate of blood flow through your kidneys. This causes your bladder to fill more quickly, so you need to pee more often. Frequent urination will continue or intensify as your pregnancy progresses. Your blood volume rises dramatically during pregnancy, which leads to extra fluid being processed and ending up in your bladder. The problem is compounded as your growing baby exerts more pressure on your bladder.
Hi Hi guys, so we have come to the Community Health Unit department of Jimmy-Do International Referral Hospital, and with me I have Asha Rai, who's a senior health assistant. We'll go on with our first question. When I was pregnant, I had terrible morning sickness, and I remember a lot of people telling me that it's not something to be worried about. But I also read that there are severe cases of morning sickness. So I want to know, when is morning sickness dangerous?
When the pregnant mother cannot eat anything due to the frequent vomiting and nausea, she even becomes dehydrated and delirious. At that time, even the brain will be affected. So she should seek the medical help immediately.
So if someone has really bad nausea, what does the hospital do? What do they give?
First, we advise them to avoid spicy food, and we tell them to have frequent meals, at least 4 to 5 times per day. Then we refer them to the doctor. Their doctor will prescribe them with tablet Doxinate, which they have to buy from the medical store.
If a woman wants to get pregnant, and she says, okay, I've come to the hospital and I'm thinking of getting pregnant, what are some preconception care and advice that the hospital has?
Preconception care is given to all the women who plan for pregnancy. Actually, it is always better to come to the hospital and get consulted. Doctors prescribe folic acid 3 months before pregnancy, and also need to continue throughout the first trimester, that is first 3 months. If a mother is with diabetes, high blood pressure and anemia, we have to correct it before pregnancy, before they conceive, with the help of medications and all. Not correct means these conditions need to be treated and kept under control.
And let's say I took a test and it says I'm pregnant. What's the next thing I should do thereafter? Do I come to the hospital to make a book, or do I just wait till I've started to show? What's the next step?
When you missed a period and confirm pregnancy test, like a urine test positive, you should report to the hospital as soon as possible. Actually, it's better if you come at around 8 weeks. We ask the last menstrual date, first day of last menstrual period. Then we'll send for, if the urine test is not done, we send the women for urine gravity test. If it is positive, then we send her for ultrasound scan. That is done to confirm, to estimate period of gestation, and also for the estimated date of delivery. You go for an Ulsan scan to estimate the period of gestation and for estimated date of delivery. After that, we have to do some lab tests like urine for albumin and sugar, blood for grouping and hemoglobin estimation, and also at the first visit we send the women for voluntary counseling and testing to rule out any STIs. Sexually transmitted diseases are there, like such as HIV, hepatitis B and syphilis.
If I find out I'm pregnant quite early, does that give me an accurate due date of the baby? Is that right?
If you can come to the hospital within 3 months of pregnancy, or around 8 weeks of pregnancy, then we consider that it gives almost accurate.
What about TT shots? How many and when should I get them? And why should I get them if I'm pregnant?
If a woman is pregnant for the first time, 2 shots of TT should be given, first dose at the first contact when she comes for an antenatal checkup. Second dose is given 4 weeks later. For subsequent pregnancies, 1 shot should be given during the second pregnancy, third also.
We have the mother and child book. When do we need to make it? Do we make it right after our pregnancy is confirmed, or do we make it later?
It is always better to make once the pregnancy is confirmed. We advise women to come within 3 months of pregnancy.
What kinds of information are in the mother and child book?
MC's handbook is a document that contains the record of the mother and the baby. There in this MCS book, you'll find mother's present and past medical history, mother's present and past obstetric history, antenatal checkup records, birth preparedness plan, laboratory investigations record, TD schedule, delivery records, postnatal visit records, and birth notification is also there. It also has delivery records, immunization records, growth monitoring records, deworming records, and also vitamin A supplementations.
How many times do we need to come for a checkup?
At least 8 times.
What happens if I miss a checkup?
In that case, as soon as you remember and as soon as you come to know that it's time for you to go, you can always come to the health center for a regular checkup.
If someone is pregnant, what is considered an urgent situation whereby the soon-to-be mother has to go to the hospital?
Pregnant women should immediately go to the hospital when she has danger signs like vaginal bleeding, high fever, severe headache, severe abdominal pain. If she is leaking like watery discharge from vagina, if there is no fetal movement, she should report immediately to the hospital.
Do you think it's necessary for the husband to come for these visits that most of the mothers have to make 8 times a pregnancy? So do you think it's important to have your partner come with you then?
Yes, we always advise the mother, the woman to come along with the husband. During the pregnancy, moral support and also husband support is very much necessary throughout the pregnancy and delivery also.
Is it bad to get too many ultrasounds done when you're pregnant? And what is the average number of ultrasounds expectant mother gets?
It does not harm the baby as such, but it is not good to do too frequently also. In genital average, ultrasound is done 4 times during the pregnancy. The first ultrasound scan is done as early as possible to confirm pregnancy and to establish period of gestation and estimated date of delivery. Second scan is done at around 20 to 24 weeks to screen fetal anomaly. Third and fourth scan, they're done at 36 weeks and 40 weeks to check for average fetal weight and adequacy of amniotic fluid.
What are some of the medicines and supplements the hospital provides for a soon-to-be mom?
Iron folic acid should be continued throughout the pregnancy and even 6 weeks after delivery. During the subsequent visit, we go for hemoglobin estimation and urine for albumin and sugar. When we get the result, we'll look at the level. If it is less, we give iron tablet along with vitamin C. Vitamin C will help in absorption of iron in the body. We start calcium tablet from 24th week till delivery, and we also advise the pregnant women not to take iron tablet with milk, coffee or tea as it hampers the absorption. Hospital gives all the supplements needed by a pregnant woman. If a woman needs to take supplements not available in hospital, doctors advise accordingly. A woman should consult doctors whether purchased vitamins can be taken with the supplements given by the hospital or not. Before taking it is always better to consult with the doctor.
If you have any questions or feedback, you can write to me at choni@bbs.bt or find me on Instagram under the name Chozuk. We'll also upload this episode on YouTube under the channel titled BBS Channel 2. Wishing you a joyful parenting, Lok Shilijege, with another exciting episode on parenting at Parentology. Until then, support each other and stay positive.